People have had food allergies since the beginning of time, right? But awareness, it seems, is at an all-time high. Thousands of grocery items now proclaim when they are peanut and gluten-free, not made with milk or tree nuts. So what are we to make of all this? Well, Dr. Roger Friedman of Ohio ENT and Allergy Physicians is here to help us wade through the hype. So an important topic, and always good to see you.
Thank you, Robin. Good to be here.
So is it perception or is it reality when we sit there and look at how many people, it seems, have food allergies?
So it's a little bit of both.
Okay.
The reality is that food allergies have increased dramatically in the last 30 years. They've probably doubled, and in particular, peanut and tree nut allergies have gone up tenfold in the last 30 years. So that's very real.
So why is it such a growing trend?
Yeah.
That's the big million-dollar question,
it is,
right?
It is probably the billion-dollar question. It really is a big deal, and there's a lot of information out there, but we're trying to sort out and figure out why it's increased, and there are a number of factors. Probably the main one is what we call the hygiene hypothesis, and the hygiene hypothesis is that because we're healthier, because we are cleaner, and because we have less bad infections, that we end up having more allergies.
Okay,
and
always a downside, I guess. Right?
There's a downside. So it's good to get immunizations, very critical to not get measles, mumps, rubella for children. It's good to not live in polluted areas and things like that. But the downside is if we live in those bad areas, we actually end up with less food allergies.
So what are some of the symptoms? I know a lot of parents out there looking, maybe their kid, I know a rash may be one of the first things, right?
When we look at food allergies, the three main symptoms we end up having, number one are intestinal, GI, stomach issues, upset stomach, diarrhea, vomiting. That's the most common thing that we'll have from food allergies. That's where the food touches the immune system. Second of all are the rashes, and we can have two. One is eczema, or atopic dermatitis. About 30–40% of children who end up with eczema have it from food allergies.
Okay.
We also can have hives. When you eat a food, you can break out in a rash right away, and then the big severe reaction that happens is anaphylaxis, and that's the person who has a life-threatening problem, and that can be a very big deal.
And when anybody really has a food allergy, is that going to be tied in then to other allergies?
It sure can be. It's oftentimes we talk about the atopic march. And those are babies and children who first develop eczema or rashes, then they show evidence of food allergy, then they'll show evidence of allergic rhinitis, hay fever, and then they'll end up with asthma. And so many of the kids will start off with food allergies and end up with rhinitis, asthma, and even things like ear disease or sinus disease.
So let's talk treatments, because obviously we don't want any of that. None of that sounds good, right? So how are you treating these?
So the first thing is to identify the condition, to make sure the person has a food allergy or not, and that's often by the history and then by allergy skin testing can confirm the diagnosis. Once we have the diagnosis, the main treatment is avoidance. And that's why when you go to the grocery, they often will say may contain, may be processed, things like that. So avoidance is very important, especially for our life-threatening food allergies. And then if a person has a food allergy and has a food allergic reaction and it's severe, the most important treatment is epinephrine, the EpiPen. To give. That can be life-saving, and that's the most important thing, and we emphasize that all the time to our families, that if your child's having a life-threatening problem, having breathing, having profuse vomiting, to give the EpiPen and you'll save their life.
Are there such things as cures for these?
Well, we're working towards that, and there's two parts to that. One, most importantly, what we do have, and we've actually instituted at Ohio ENT and Allergy, that we have a way to prevent food allergies. There's a study called the LEAP study, and by early introduction of foods, especially for peanuts, once we've identified a child who's at high risk of developing peanut allergies, we allergy test them, and if they're negative, we start them on a peanut protein diet. We actually give them a teaspoon of peanut butter a day, and that can decrease the development of peanut allergies by 85%.
Yeah.
So that's a really big deal. That's huge, and that's been life-changing. And then in the near future, in the next 3 to 4 years, we're actually going to have a definitive treatment. It's going to either be in the form of a patch or an oral treatment or a sublingual under the tongue, where we'll give increasing quantities of the food to try to improve and eliminate the food allergy.
It's always good to know that there is hope on the horizon. I mean, a lot of people dealing with this, so.
Great hope on the horizon, and again, we're very close to having a definitive treatment.
I love it. All right. And of course, if you want to contact Ohio ENT and Allergy, get that testing. If you're, nervous about your kid, that's the first place to start. So Dr. Friedman, thanks for being here.
Thanks for having me.